Well, meanwhile, Singapore has seen its first local transmissions of the coronavirus. It's occurred in 4 patients who hadn't recently travelled overseas, and they're among 6 new cases announced today.
The cluster of 4 cases is linked to Chinese tourists who visited a health product shop. The group comprises 2 shop assistants and 1 tour guide, who are Singapore residents, as well as 1 foreign domestic worker. The tourists arrived from China on the 22nd of January, before Singapore's travel restrictions were put in place.
The tour group visited the health product shop the next day before going to Malaysia. The 2 other new confirmed cases are among 92 Singaporeans who returned from Wuhan on a scoot flight last Thursday. Now, today's new cases take the total here in Singapore to 24. There are 32 pending test results, with 524 people under quarantine. Our reporter Cheryl Goh tells us more.
Authorities here are stressing that this is really not a case of community spread, which is defined as having spent more than 30 minutes or so with infected individuals in a 2-meter proximity. But what this really is a limited local transmission after some of these individuals had prolonged interaction with sick persons. And for this case in particular, the source has been identified, which is a group of tourists from Guangxi, China. And also there is really no evidence of transmission of other cases popping up in other parts of Singapore. And this is what our Health Minister Gan Kim Yong has to say.
There is limited community spread in the community transmission. The idea is that there is a contact source of the infection that is not imported. So there is a secondary transmission from one of the infected person to a local. So both are locals. So this is therefore a limited community spread, but it is not a widespread community transmission. And the main difference is that for this particular cluster, we are able to identify all the contacts that are involved, including the source of the infection. As I mentioned, they were involved, they were in contact with a group of Chinese tourists from mainland China, and this particular group of mainland China tourists, we were able to have their names, and we have indication of who were the individual patients that fell ill and were confirmed as a positive case for this novel coronavirus. And therefore, we are able to identify the specific source. If we are able to ring-fence this particular cluster, then we will be able to control the infection spread. So therefore, we say that this is a limited local transmission. But when you have cases popping up in different parts of Singapore, different clusters occurring, and you may not be able to determine the source of these clusters. You can have a few cases where you have no idea where these cases come from. They do not have a specific source. Then you have a widespread transmission.